Hey everybody. I wanted to just kind of go over what I've been dealing with recently, and I wanted to really make this video about the fact that not everyone that gets sick is old and unhealthy. Um, Now we can say that it's more likely to be the case, but certainly not everyone that is sick is old and unhealthy. I mean, let me give you a background. I'm 28. I have eaten pretty well. I try to eat my vegetables. I eat, lean meats, legumes, nuts, and um, healthy dairy, like plain Greek yogurt type thing. Um, yeah, lots of green leafy vegetables. Try to at least smoothies, berries, fruit, whatever. I exercise. I have exercised all my life, but particularly I've exercised almost every single day, lifting weights and um, like intensely, I would say. Um, Probably for the last 11, 12 years. And even before that, I was doing martial arts and I was doing different things. Always active. I've always been an active individual. Um, yeah, my sleep is not the best. I think it's genetic because I try, but I try to get it at least in my sleep. So it's not like I'm purposely shutting myself off. Um, I don't really smoke. I would say like I used to smoke a bit of weed, like cigarettes. As in, I wouldn't even buy a pack. I wouldn't even smoke a cigarette. I'd just have a couple puffs every, I would say, once every couple months or once every month, sometimes even longer, sometimes 2 weeks. Just on average, I mean, significantly less than the average smoker, like by a multitude of hundreds of times difference, like hundreds fold. So, kind of negligible. That's not why I'm coughing. We'll get to that. Um, Drinking, I don't really drink. Like I'm pretty healthy. Um, but I was diagnosed with cancer about no, it's 2 weeks ago, and I can't exercise anymore because, well, for now, before I get my chemotherapy, I have like a baseball-sized tumor in my mediastinum, which is like in front of the chest. It's Hodgkin's lymphoma, so it's treatable, but I mean, cancer's no joke. You're gonna have to go through a lot of tough times to at least try to cure it, and I feel pretty confident about curing it. But never take your health for granted, please, and always get it checked out. Get something checked out if you think something's wrong, because I was wondering kind of why I was getting sick for probably about 2 years now, maybe a year and a half. Could be longer, but probably not significantly longer than that. I stopped really making a lot of strength gains in the gym. I was kind of keeping up in certain ways and certain exercises, and I was still pretty strong, but not what it used to be. And I started getting sick more often. And the last one was the reason why I went to the hospital and ended up with my diagnosis. So I got very sick. I was still working. I was very stressed out. I was working like way too much, and my assistant was gone, so I didn't have help. I had to work all the time to keep this business running. And because of the cold and whatever it might have been, I got a really bad cough. Typically, when I get sick, I get a cough. And I was coughing and coughing and started coughing up a bit of blood. Hasn't been the first time I've coughed up blood in the past, but this was different, I would say. It was almost every day, small amounts. And it's concerning. That's something to check out, right? And I haven't checked that out in the past. I've done it years and years ago when I probably didn't have cancer, but it happens when you have traumatic instances with the respiratory system. So, you cough a lot and it can happen. Mind you, not much, like a lot less than a drop each eat spit, like it would be mixed with mucus and stuff. Might have been pneumonia or something at the time. It got to the point where I had to work while I was sick as well. And it got to the point where I got to the shop and I was going to do laundry because I have a laundry facility there. And I truly felt so weak that I couldn't walk up the stairs to go to the laundry. And I took a minute in the truck and I sat there, and it was cold and it was horrible because the cold really, um, it really irritates the airways, and it can make these things so much worse in terms of the feeling, in terms of getting more sick, because obviously your immune system's fighting really hard, especially when it's cold, because it has to warm, your body has to warm up. It's using energy. Um, and I thought, I can't go upstairs. I have to go to the ER. I have to go. Um, Prior to, I want to say this too. When I was doing heavy squats, barbell back squats, because I have my back in a like retracted position, while I would go down deep, I would feel a pulling, kind of like a tension in my chest, and I felt like there was something there. I didn't think I thought there was something, but I wasn't 100% sure. It was just, oh, maybe, maybe it's something from my chest, from micro injury from lifting bench press, doing bench press stuff. However, my chest was kind of slightly tight for over a year. When I had a maximal intake of air, when I breathed maximally, I felt a tension in the upper, like kind of clavicular area. Mind you, it's here. It's like right kind of in front of the bronchioles to the right hand side. Um, and so yeah, I went to the hospital and I said, "Look, I'm spitting blood. I'm coughing blood. I'm very sick. I need to know what's going on with me." And so I waited. They gave me blood tests. Mind you, I do blood tests all the time. This is why you need to do other things to make sure that you're healthy, because do blood tests, urine tests, all that stuff, STI screening, things like that, just to make sure I'm safe. And it's always good. So I'm always fine, clear. But and of course my blood was fine this time too. But they checked me out and they said take a deep breath. They checked my ears, check whatever. Asked me a bunch of questions. And here's what saved me. At least at some point I would have figured it out, but this is how I figured it out. He said, "Okay, well, you're doing all right, but it seems like everything's okay. I'm just gonna make sure that you don't have signs of pneumonia." So he gives me an X-ray. Then I come back into the waiting room, and I'm with my mom. Thankfully, she was there to help me out and to guide me through it. And so I sat there, and not too long after, they say, "We're gonna give you a CT scan." And so I'm wondering, okay, like, it seems like this is more than just something, right? You would think after the X-ray, if it's after it's all clear, they would just say, okay, you're good to go. But no, they gave me an CT scan, which is they put you in like a tubular machine, and it goes around and you do a scan of the body. And so I came back into the room, and they gave me another CT scan, and this was worrying. Then I was starting to really worry, right? I thought maybe, fuck, if I have lung cancer or something, which is odd at this age for sure. But nonetheless, they jabbed me with the IV to put in this IV contrast. This is like a dye, puts it through your body. And so I did the scan, and I got quite sick after the scan, probably something to do with the IV. I puked in the bag, but it was just water because I haven't been eating, thankfully. And then I go into the waiting room. I'm worried. I'm really worried. And I'm just trying to keep my cool. We're waiting for a long time, but we have to wait, right? We have to see what's going on. The doctor calls us into a room, and he asked my mom to come with me. So there's something going on. So he said, there's a mass in your chest. We don't know what it is, but it seems like a fatty mass. And then he said, we're going to set up a biopsy at some point. You get a call so we can figure out what this is. And of course, they can't say anything as to what it is. They don't know, but it's just massive mass in my chest. And so I didn't even know what to think. I was just shocked. Um, Yeah, I went to the washroom. I had I'm not gonna be scared to say it. I had diarrhea because my whole body was in shock, and the whole night I had diarrhea. I was horrified. I was terrified. Um, and I mean, I had like kind of like horror violins in my mind. Like I couldn't even stop it. It was just something that was just in the background of my head while I was trying to sleep. Didn't get a wink of sleep, of course. Um, Then I get a call from this oncologist, and he talks to me, and he's saying, what we're looking at right now is lymphoma. It could be many other things, but these are the things we're kind of looking at. It could be other things. It's not saying that you have it. And of course, he's trying to calm my parents down. This was, mind you, a week after. So, sorry, backtrack. I had an biopsy before this, thankfully, and they did a needle aspiration. So they put needles into my chest through the intercostal muscles and then into the mass 4 times. Thankfully, they got that done, and then they did another CT scan to make sure that I don't have lung collapsing or anything like that. So I was good. But he said, "Look, this is what we're looking at, and it's not." He didn't say it was likely, but he didn't say it was unlikely. And these doctors can't lie. And so, he was talking to my parents to the side. I kind of heard a little bit of it, but he was just trying to calm them down because they were in more of a panic mode than I was, because I started to come to terms with the fact that I could very well have cancer. And he came in, and I asked him, "Look, I'm going to be honest with you. I want you to be I know you don't know, but just tell me what the possibilities are." He said a germ cell tumor could be, it could be malignant, or it could be benign. It could be an infection, which is not likely, as in the mass is an infection. I mean, it's very rare that a mass outside the lung can be an infection. It's like a soft tissue mass, right? So that's not common. And then he just flat out said it's not likely, but he's been surprised, right? And he said, or it could be lymphoma. So I looked at him, and he had a mask on, but I kind of, accepted the fact that this could be cancer, very likely. So I waited for my results. Unfortunately, he didn't have them, but he said, "Look, they're working on it. The staining takes a long time. The lab work, they need to be very particular, very precise, because they need to make sure that this is what it is what they find it to be, and not something else, so I'm not misdiagnosed." Sure enough, about a week after, less than that, my doctor said, "Okay, is your parents around to," he called me, "is your parents around to hear this?" And I said, "Look, tell me." And he said, "Hodgkin's lymphoma." And I was worried, but I was kind of freaking out, but I was a lot less than you would think, because I knew in the back of my mind it was likely. So, and I know there are maybe some of you that are watching this don't have this situation. And if you don't, great, but just look into the ways that you can protect yourself early on if you have something. If you have symptoms, whatever it might be. I mean, my mass is quite big, and it's pressing up against my lung. So that's probably why that, I get the blood and everything. It's damaging slightly my lung because it can't properly inflate. So the chemo hopefully will get rid of that quick, so that it shrinks and my lung can properly inflate again, and I'll be coughing up a lot, but I will hopefully get back to normal. And just know that we are not invincible, and you must not think that these things can't happen. You must I wouldn't say just think of, "Oh, okay, well, it's going to happen for sure," or "It's very likely." Don't worry about it. But if you have something going on, something not normal in your gut, just try to get it checked out. I know in the United States you have to pay every time, and that sucks, obviously. If you don't have the money, it's even worse. So I can't say much about that. I would say do what you can. But if you do have a universal healthcare system, all of our healthcare systems are really, really kind of in a bad place. I mean, they're really strained. So do what you can to be your own advocate and inquire, inquire, and try to get referrals for these specialized tests and things, because a lot of people don't get X-rays on their chest, and there's all kinds of things that they find in some people. A lot of the time, it's benign. It's just a lump on the lung or something, but could be cancer. You never know. Um, and I do have cancer, so um, this whole year for me will be a write-off. I know it. It's I haven't exercised. I mean, my mom's taking care of me, so I'm staying home, staying at my mom's place. She's taking good care of me, thankfully. But the chemo's gonna wreck me pretty bad. Um, Hopefully, when it's resolved, and most likely it will be cleared up by the chemo, I can have a second shot at enjoying life and appreciating the small things. So, if you made it this far, thank you. And please take care of yourself. Bye bye.